Is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good morning. Welcome into the program. It is Mon Health Talk, and back in studio, and the perfect day to be back in studio. I'll explain that here in just a moment. The one, the only, the incredible Sarah Giossi.
Hey.
Hey.
How are you?
I'm doing great. How are you?
I'm doing well. I'm happy to be back. I'm seeing that in my brief departure, everything was falling apart.
Oh, yeah.
So,
the whole place was in shambles.
the whole day today, I'm just cleaning up messes.
That's
and right.
well, both figuratively and literally.
Right.
Well, I am extremely happy that you're back today, given the subject material. You ever hear the? Have you ever heard the phrase "stay in your lane"?
Yeah.
I'm going to stay in my lane today. Joining us in studio is Dr. Kerri Hall, OBGYN at Mon Health Women's Health. Good morning, Dr. Hall.
Good morning.
Thanks for coming in this morning.
Thanks for having me.
All right, so the expert is right there on this show. I have dogs. Obviously, we're going to be talking about women's health. We're going to be talking about OBGYN. We're going to be talking about having babies and all that good stuff.
Yeah.
You know all about it.
Very near and dear.
So let me ask these two questions, and I'm just going to sit back.
Okay.
Tell us about yourself, Dr. Hall.
Well, I am from Fallensby, West Virginia, originally. So
Okay, let's stop.
We
That's
don't
where my
hear
wife's
that
from.
very often.
Yeah,
Oh,
my wife
great.
is from Fallensby. Yeah.
most people kind of nod and say,
Oh,
Where's
yeah,
that?
Fallensby.
Good.
Yeah, I know Fallensby.
yeah, Northern Panhandle.
Really?
And so, yeah, I went to that other medical school in Marshall.
No, go ahead. Be proud. You're
Yeah.
He's a
Marshall
Marshall
grad
guy.
right here.
Well,
Yes.
we
So,
have a lot in
look, you
common
two,
already.
I know, this is amazing.
All right, maybe you should
Maybe
just
I
be
should
quiet
walk
and
out,
walk out of the room.
Yeah, so I trained at Marshall, went to medical school at Marshall, and then came up here to Morgantown 12 years ago, and I've been practicing here since then.
Wonderful.
So what drew you to women's health and ultimately to be an OBGYN?
I really enjoyed it, women taking care of women. I enjoy that. I think men can do a perfectly good job, don't get me wrong, but I enjoyed the relationships I'd make with my patients. When you have a baby, you meet someone, you take care of them 9 months, and then have the ultimate result. And that's very satisfying to me. And then you continue to see them for the rest of their lives for yearlies and try to prevent problems and see how their family grows. And I like that. I like that personal touch.
You kind of become a part of the family. You might not even realize it as much, but I think about that with my OBGYN. I mean, she's a part of our family. She's in all those pictures of the first moments of life and,
Yep.
all of that kind of stuff. You're probably in baby books you don't even know about, right?
Yes.
So whenever we're talking about Mon Health and if somebody's out there listening who's interested in maybe finding an OBGYN, what options are available for women and their families, and why should they reach out to you guys?
I think we have an excellent group. I really do. We have a variety of people. I mean, not every personality meets every person's need. I think that's a personal choice. If it doesn't mesh, find someone that meshes with you. We have 6 OBGYNs in our office. Everyone's nice. Everyone's good. I mean, knowledgeable. We have 3 nurse practitioners. They're well established, so I feel like they give good care.
A huge part of the relationship with an OBGYN from personal experience is trust.
Mm-hmm.
And it's nice to even hear you as you talk about your colleagues and the team. There's so much trust there. And I just think that that's something when I look for an OBGYN, it's so important because you're going to someone, it's very intimate. It can be a very private experience. And also you can talk about things that, whether it be societal or just how you were raised or the fact, there's certain things we're not, quote unquote, not supposed to talk about.
Right.
And we talk to you about them.
Mm-hmm.
So, yeah, it's just one of those things. I wanted to add that. It's really nice to hear you talk about the trust that you have. So, whenever someone's looking and they are perhaps in a place where they're trying to do some family planning or wanting to start to go down that direction, talk a little bit to us here about safety and priorities as a doctor whenever it comes to the mother and the baby.
When someone's pregnant for the first time, we hope everything's going to go smoothly and have a natural delivery. I mean, there's statistics on how many people end up with a cesarean, but we really want people to try, if everything's healthy, mommy and baby's healthy, come in labor on your own and try to do the least amount of medications, because really statistically you'll do better. We are people who, if there's a medical issue, sometimes we have to induce labor or start Mother Nature's job, and that puts a little higher risk of not going the way it should.
Mm-hmm.
But I think ultimately when you talk to a patient, our goal is a healthy mom and healthy baby, both. And to me, most people want that. And most people do want a natural delivery, which I think we want as well.
Yeah, and when you say natural, we're talking about the fact that there are a lot of different options out there.
Mm-hmm.
So natural versus having an operation, but also natural whenever you're talking about medicated versus unmedicated.
Mm-hmm.
And you have all of the options available to moms that are out there thinking about this.
Yes. And to me, it's their delivery, not mine. So I try to tell first-time moms, hey, keep an open mind. You've not done it before. If you want a non-medicated delivery, I will support you. If you change your mind, I will support you.
Mm-hmm.
I've done it. It hurts.
Yeah.
But and sometimes someone wants an epidural and it doesn't work as well as they anticipate. And to keep that open mind that, sometimes you just have to roll with it. And to me, it's the introduction of motherhood. The baby's in charge and we roll with it. But we try to explain what's going to happen. I think the birth classes at the birth center are nice. I think education's education. The more you know, I encourage a birth plan if they wish, because people don't understand. Sometimes babies get antibiotic, in their eyes when they are delivered. They get a vitamin K injection, and that's kind of shocking when they haven't been prepared for it.
Mm-hmm. And whenever you talk about birth plans, I'm hearing two things. One, it's good to have a plan and to go in and have an idea so that you can communicate with your physician. But it's also good to be flexible, because sometimes you will change your mind, or in the moment things could change, and not maybe being disappointed that you're not following your plan to a T. I'm the kind of person, when I come up with a plan, I want it followed. And the importance of flexibility in that, because it is a natural process that could go very different ways.
Yes. And to me, saying that ahead of time than while they're in labor.
Yeah.
Because, things are heightened when they're in labor. Talk to people ahead of time, I think.
Understatement of the year. Yeah.
All right, we got to squeeze in a quick break. I hate to interrupt this conversation.
No, it's great.
Joining us in studio this morning is Dr. Kerri Hall, OBGYN at Mon Health Women's Health. We'll continue the conversation next. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, call now at 304-296-0041.
Dr. Kerri Hall is our guest in studio this morning, OBGYN at Mon Health Women's Health.
And we were talking just a little bit ago about mother and baby safety, and I did want to just mention that whenever we're talking Mon Health Women's Health, award-winning birth center for patient safety, that's something to mention. Yeah. That feels really important. So talk to me about that. How do you win that award?
Well, we keep statistics on complication rates, bleeding, hemorrhage, infection rates. With most hospitals, we all are really important, to educate patients on the medications they're receiving. I think we have an excellent staff at Mon General Hospital. The nurses are good. They're very caring. I think you can tell when you're there. But I think it's a very clean environment. I think that everyone takes a lot of pride in what they do there.
Yeah. And whenever we're talking about patient safety and, sometimes emergency situations do pop up. And I know personally, I had a birth plan the first time. It did not go according to plan. And I ended up having to have an emergency C-section my first time. Talk to us a little bit about that. And what's the difference between an emergency C-section and a planned C-section?
A planned C-section is usually something that is decided before you go into labor. Most of the time, that's not with your first child. There are some instances that, a first C-section, a breech baby, it's not safe to deliver a breech baby naturally. That would be a reason. Or there's mother or baby reasons, but those aren't terribly large in number. An emergency C-section, there's different levels. There's the, oh my goodness, we need to get the baby out in 5 minutes C-section. And there's the, well, we don't think things are going well. Let's do this in a calm, collected manner. Those are kind of the differences. I don't know if that helps.
Yeah, no, it does. It helps a lot. And okay, as someone who has had C-sections, a lot of times people think, well, a C-section seems like the way to go because you can maybe avoid some of the stereotypical or things that you see on television, ideas of labor and delivery. And you think, okay, it's a surgery, you're in, you're out. Help people understand. Maybe it's because I'm so intimately familiar with this. The recovery process is very, very different.
Yes.
And it's certainly not an ideal scenario, right?
It is not an easy way out. For a cesarean section, yes, I mean, it's major surgery. So people do need pain medication, and that's a mixed feeling with a new mother, but it's major incisions. No heavy lifting for 6 weeks. Usually I tell my patients no driving for 2 weeks. You need to really be careful about your incision and not doing too much. And you have a newborn to lift and carry in a car seat and diaper bags. And it is a lot more pain compared to a natural delivery.
And in my case, a 30-some pound toddler to deal with too. That was the hardest part for me.
They don't understand that mommy can't pick you up.
Exactly. It's really tough on them. Yeah. All right. So we've talked a little bit about C-sections, and I know that you guys do, just to kind of echo that, you have a low C-section rate at Mon Health Family Birth Center. When we come back, because we do need to fit in another break here, we're going to talk a little bit about the baby now, because we've been talking about the mom and what these procedures look like, but I want to talk about the baby because that's the exciting part of all of this. So we'll be doing that on the other side of the break here on Mon Health Talk.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our Mon Health guests, call now 304-296-0041.
Got a couple of minutes left in the program today. Dr. Kerri Hall, OBGYN at Mon Health Women's Health, joining us in studio this morning.
Now, we've had an opportunity to talk about the experience of the mother whenever they come to the birth center, but let's talk a little bit about the baby. Now, the Mon Health Medical Center Family Birth Center was the first hospital, can you tell I'm reading and can't do a very good job, to be designated as baby-friendly. What does that mean?
Baby-friendly is like a nationally recognized, I don't know how to say, award.
Okay.
It takes a long time to get this certified. I guess certification is a better term.
Okay.
And the ultimate goal is for people to be as supported as possible with a newborn, but we would really like for people to breastfeed. I think it's the ultimate primary care, but, we will support whatever moms need. But this is from birth. I mean, when the baby is born, we want that baby to be next to the mother's skin or daddy's skin for at least an hour. And that was a major change for us. We want babies to not get pacifiers while they're in the hospital unless the parents bring it in, because sometimes that can reduce the likelihood of breastfeeding. And we have specially trained nurses, the doctors are trained, the personnel. We even have in our office, we're baby-friendly certified, so we have the right communication and education for patients. And if they want to bottle feed, we will perfectly accept that and support them because moms need support.
And whenever you're talking about that, do you have lactation consultants as well?
Yes, we have lactation consultants. We do have a lot of the nurses, the labor and delivery nurses are well educated, and that is who really helps the most because they're there with the patient most after delivery.
Amen. They are the unsung heroes. They are so helpful. And I know, again, whenever we talk about baby and different options that we have, things like delayed cord clamping or some of the other, there's just a lot of new information that has come out in recent years. Do you offer the option for mothers and fathers to choose options like that? Are those on the table as well?
Yes. Delayed cord clamping has been a big thing lately. It's when the baby's born, you wait till it stops pulsing before you clamp it and cut. That is especially recommended if a baby is preterm. That is actually medically recommended. And if a baby had a little bit of trouble, there was a heart rate abnormality before, sometimes that helps them recuperate. But I offer it. There's no reason to not do it. It's perfectly safe to wait.
So if somebody's out there listening and they are interested in finding out more about the birth center or reaching out to you in particular, how can they get in contact?
We would you go to monhealth.com/OBGYN. That has a lot of great information, calling the office for an appointment. We have lots of providers, so we have open spaces to see people, and we'd happy to see anyone and talk to them.
I know the answer to this question.
Okay.
Facebook page, right, Emily?
Oh, Facebook page.
There's a Facebook page. Go to the Facebook page.
Great. And this isn't the type of thing you need a referral for or anything. They can just call and make an appointment and set something up.
No. Sometimes annuals might need referred from their primary care doctor. Most of the time they don't. And I mean, we accept all major insurances and Medicaid and Medicare.
Dr. Kerri Hall, OBGYN at Mon Health Women's Health. Thanks for stopping by the studio this morning. Appreciate it.
Thanks for having me.
And Sarah's
back.
Thanks for coming back today, because apparently I can't talk.
Well, I can't read, so we're quite the pair.
Ought to be an interesting hour coming up. We will formally welcome Sarah back in the main segment of the Talk of the Town. Up next, it's Fox News Local News and the Talk of the Town. Straight ahead on the Voice of Morgantown, WAJ.